Amy Whitcomb-Slemmer is with us. She is a healthcare attorney and the executive director of the Massachusetts Healthcare for All group, HCFAMA. HCF, what is this? What's that?
Healthcare for All Massachusetts.
HCFMA.org is the website. Okay, great. Yeah, of course, that makes perfect sense. So being from Massachusetts, I'm assuming that you have some familiarity with how Romneycare worked and how it rolled out. Were you there when it rolled out?
We were, actually. Healthcare for All has been around. We're a nonprofit organization. We've been in existence for almost 30 years. So
Wow.
Romneycare really was the culmination of decades of work and dedication by our staff and also other stakeholders that we brought in and worked in coalition with. So figuring out what we all had in common was a dedication to get everybody health care coverage, and that's what we managed to do.
I think that there's a couple of analogies here that we can draw. One is that, back in the mid-'60s, when 65, I think it was, when LBJ rolled out Medicaid,
yes,
it was voluntary for the states, just as John Roberts just made the Medicaid expansion. And you didn't have all the states pick it up. And the government was only paying 56% at that time, so the states were saying, there's some real expense here. Now every state has Medicaid. I think it's just a matter of time before every state expands Medicaid under Obamacare. But what are there's a lot of analogies that can be drawn with Romneycare, between Romneycare and Obamacare, because they're basically the same program, are they not?
That's exactly right. They have the same mechanisms. It's the same fundamental structure of providing access, requiring everybody to have coverage or pay a fee if they decide not to be insured. Making sure that coverage is affordable by providing subsidies, encouraging employers to provide access to and offer their employees coverage, and then requiring providers to see us when we have coverage.
Right. Now, there's no public option in Romneycare, is there?
There is increased public subsidies, but no, there is not a per se public option. We have a robust Medicaid program, but it's not single payer. No.
Do you think it's possible that the reason that there's no public option in Obamacare was because the White House was looking at Romneycare and making a political calculation? We may have to run against I'm out weird conspiracy theory land here. And so the more we make it identical to Romneycare, the less Romney will be able to beat us up on it. And if we put a public option in it, then he'll call that socialism or something.
Oh, my gosh. I don't know. That's so far down the road.
That's for a political commentator. Okay, yeah, you're a healthcare expert. So what should we expect? Based on, you've seen this roll out in the state of Massachusetts, a virtually, maybe literally identical program. And right now we're hearing, you read the websites on the left, you say, Obamacare successes. You read websites on the right, Obamacare's falling apart, it's in a death spiral. What's the reality, and what can we expect?
Do you know what the truth is? We're somewhere in between. The fact is, Obamacare is infinitely better than what we currently have across the country. What we experienced in Massachusetts was there is some cultural shift that has to happen as you are requiring people to buy coverage, and that coverage has to be made affordable. But now, we are now 7 years into Romneycare in Massachusetts, and it's the way we live. It's just a fact of life.
So nobody thinks twice about it.
They don't. And
it's like Social Security.
It is. And if you look at our statistics, we have the highest coverage rate in the country. We have 97% of adults in Massachusetts have health care coverage. 99.8% of children in Massachusetts have health care coverage. Isn't that extraordinary?
Are those 3% who aren't covered people who are just like homeless or you can't reach them?
It's a really good question. So they're not a static group. Some are folks who are new to the Commonwealth. Some are folks who have rotated off coverage, and some we haven't gotten yet that we will find. The number of children, if you can imagine, we only have 3,000 uninsured kids in Massachusetts. Now, for Healthcare for All, that is 3,000 too many, and we want to find every single child and make sure they have coverage.
Sign them up.
But if you are a parent who has a child who has coverage, you can sleep easier knowing that if your child slips, you can get a doctor's appointment, you will get the immunizations that your child needs to be qualified and ready to go to school. It makes a tremendous difference, but it's the law of the land. So we've been living with it, and it continues to be popular in Massachusetts.
Now, with Obamacare, because of the subsidies that are built into it and because of the Medicaid expansion, and let's assume that all the states participate, or just talk about states that do, there's a certain percentage of the country or percentage of the state that is covered for basically free. And looking at the numbers, it looks to me like that's probably somewhere in the neighborhood of between 40 and 50%. The bottom 40 to 50%. Or am I missing?
That the
Tell me where
federal
it is.
government will cover, you mean?
Yeah.
So for the
Yeah.
Medicaid expansion,
Well,
you're
or
exactly
how does
right.
it work
It's nearly free.
in Massachusetts?
Well, it's more generous now under the Affordable Care Act than it was before we had the ACA. We have a better match rate for our Medicaid population. It's marvelous to be able to have these federal dollars that allow us to expand, cover everyone, and then go to work. The next thorny issue. So I want the rest of the country to get coverage. I want them to go sign up, go explore what the ACA means for you
Go
personally.
to healthcare.gov.
Go to healthcare.gov and see what this means. And if you don't have access to a computer, go find a navigator or a community assister, a consumer assister who can help you by figuring out what your questions are and what you qualify for, what programs, what coverage options are out there for you. Do that.
Yeah.
And then when everybody has coverage and everybody is trying to access care, and hopefully we see some uptick in some great health statistics, then we've got to go after the system itself. We need to reorganize the system so that it really is more consumer-centered, so that we are paying for value. We're paying the healthcare system to keep us healthy. Right now, we access the system when we're sick, and there's more money to be made as more is done to you. Less money to be made if it takes only a couple of times or a one intervention to get you well.
Well, and less money to be made means less money to be paid.
Yes.
So the more that we can get people participating in the system, the more we can catch diseases before they become crises.
Exactly right.
The less money we're all going to pay.
That's exactly right.
So, wow, yeah. So Healthcare for All in Massachusetts, HCFAMA.org.
Exactly.
Is trying to reach out to all the folks across Massachusetts. Is there a similar program across the United States?
There are wonderful organizations very similar to Healthcare for All in almost every state. And there's a group called Community Catalyst that helps provide technical assistance to those grassroots troops who are trying to sign people up, trying to educate people. It is a law that we want to work well. You mentioned the states that have not yet taken up the Medicaid expansion. We have to get the people who would otherwise have health care coverage to push their legislators and leaders to say yes to Medicaid expansion.
5.4 million people who
Good grief, who need care.
Right, and whose governors are saying, we pay federal taxes, we sent the money to Washington, D.C., but I'm not going to let that money come back to my taxpayers. It's insane.
Wildly short-sighted.
It's and crazy. Amy Whitcomb-Slammer, thank you so much for being with us.
What a pleasure. Thank you very much. Nice to meet you.
We'll be back.